Hello, and thank you for taking the time out of your day to spend a little time with us as we break down our Medicare Exchange platform. First thing we're going to do is I'm going to get logged in. Medicare Exchange platform is very robust. It can compare Med Advantage, prescription drug plans, and some Medicare supplemental plans. It'll allow you to put those Medicare Advantage plans on a side-by-side comparison. It'll allow you to send those quotes to your customers via email or text message. It'll allow you to do face-to-face enrollments through text message, through email, or it'll also do phone recording through the platform as well. But it is very robust, so we're going to go through some of those items that the tool provides real quickly here today. Just a quick overview, and to get in touch with your ADCs to get access to this platform. For those that are interested in selling Medicare or already selling Medicare, this is a very, very efficient tool that makes agents very efficient. Takes a lot less time off of their plate, a lot of stress every year updating drug lists. So what we're going to do first is create a new profile. So we went up to new profile, create a new beneficiary. Just punch in our home zip code here, 58102. Test client, May 15th, 1960. That is somebody turning 65 next month. Put their email address. Fields are relatively smart. As soon as you start typing in a house number, it's going to start pulling up houses in that zip code. We start typing in our address, it's going to pull it in. If you want to add a sales contact information, maybe you have somebody who has healthcare power of attorney over this beneficiary, you can add that in. Most of the time it's no. You can also add in their Medicare beneficiary identification number, so their MBI, their A and B effective dates. If you check eligibility, what it's going to do is it's going to check the data that you've entered, first name, last name, date of birth, Medicare number, A and B effective date. It's going to send that to Medicare. Medicare is going to come back and it's going to be successful or not successful. If it's successful, that means you got everything spelled correctly, the dates are correct, the Medicare number is correct. You should have no problems when you go get to the enrollment portion of the enrollment. It also has Medicaid eligibility to check Medicaid eligibilities. This is going to be more for DSNP customers, dual eligibles. You can do those federal Medicaid checks in certain states and check that eligibility of what plans they may enroll into. Once you're signed in, got the profile created, you can do a few different things. On the right-hand side, you can see retire flow. This is an extra feature you can add to your platform. It does cost a little money, but it is super slick. It sends surveys out to your customer. They can complete that survey. That survey is going to update their address. It's going to update their prescription drug list. It's going to collect a scope of appointment for you. So a lot of agents will send these surveys out during the annual enrollment period to update their database and have the customers do it, relatively quickly on their own time. And then that data flows back to the system for you to run that comparison and do these new enrollments or just let them know they're good on the plans they're on today. SOA stands for scope of appointments. Scope of appointments, you need to collect 48 hours in advance of any meetings. You can do that through the system in a couple of different ways. We'll get to that in a minute. You can also add notes to this person. Turning this morning. Turning 65 in May. Add a note, so you can put different notes on the inside the platform. You can also add tasks. Maybe in April or June, I want to follow up with this. Follow up with a cancer policy. Make sure they received cards. Really can't type. So now we have a task that's set up for 6/1. Continue scope of appointment. So from here, we can complete it in person. We can complete it by phone. We can print the form and upload it. We can email it to them. We can text message it to them. I'll show you how the process by completing one in person. So the scope of appointment is really just documenting that today's meeting is going to be about standalone drug plans, Medicare Advantage, Medicare products, or ancillary products. It's going to have their contact information, if they have a power of attorney or power of healthcare. Go to the next page. Now this is the agent portion. We'll put that this was a customer referral. You can add notes if it wasn't completed 48 hours in advance. You can pick as an agent, the agent, what products you're going to be talking about. Check the agent that you are you. And now we have a completed scope of appointment that you can download, save, send to the carriers if needed, when they ask for that scope of appointment. Next, we can either continue on to plans or we can add more preferences. I usually recommend adding more preferences. This is where you get that Medicare.gov look and feel for the consumer, but it's on an agent-built platform. So from here, we're going to be looking for medical and prescription drug plans. We can put in if they get Medicaid or Medicare Savings Program or extra help with Social Security. A lot of times it's going to be do not get extra help. I'm going to put that in there. Next, health. We can actually also estimate health costs across different plans. So if we wanted to, we could click yes, and we could put, I want to see what the costs for the next year under each of the plans would be for one chiropractic visit, 5 labs, diagnostic tests, 2 doctor visits, 6 specialty visits, 2 outpatient surgeries. From there, we can update the answers too, and we can change them. So let's say 1 surgery, maybe 1 hospital stay for 3 days, and maybe 1 emergency visit. So we'll save this. Now we got our hospital profile created for the year, our health profile. Again, this is a guesstimate. You're never going to be able to get this perfect, but this is just to show customers what the plans, how they operate, how they look like, what the estimated costs will be. We can list providers in here if we want to. You can look them up. Sure, if I look up a Smith, there's probably a ton of Smiths, and you can pick your doctor, add them to the list. Prescriptions, we do the exact same thing. We start typing, the list shows up, their med shows up. We can add, maybe they get 90 pills of this every 3 months. We can add more medications. Typically, they get them every 3 months. Some of them might have quantity limits or step therapy where they have to get prior approval or prior authorization. I'll put an expensive one in there just for fun. We'll do it per month. Pharmacies, it's going to pull up all your pharmacies within that zip code. You can change the zip code. You can pick up to 3 different pharmacies. So we added 3 pharmacies: CVS, Medicine Shop, Thrifty White. Now it's thinking, going through all the different plans. It shows in this county, we have 17 Medicare Advantage plans with drug coverage, 13 Medicare Advantage plans without drug coverage, and cost plans are included in this as well. And then 11 prescription drug plans, 25 Medicare Supplement plans, 11 dental plans, 2 vision plans, and 1 hospital indemnity. As an agent, I'm licensed with almost every carrier in our neck of the woods. You can also add non-licensed plans. So this will show the entire picture of every plan that's in the market, giving you the breakdowns. You can see it didn't really change much for the Medicare Advantage plans, but it did change a little bit for the drug plans. Again, this has got all the plans sorted now. So right now we're sorting these plans by estimated drug cost, low to high. Maybe we want to sort them by total estimated cost. Maybe we want to sort them by maximum out of pocket, low to high. So we're looking for what is the lowest, maybe the most robust plan, but not necessarily factoring in the premiums or the drug costs. So you kind of use this search tool to find out which plans you're really wanting to compare. But let's say we want to compare the next Blue Cross North Dakota, to the Sanford plan, to United Healthcare's Medicare Advantage plan. Now we selected 3 plans. We can differentiate them between pharmacies. We can, use this over here to filter out some of the plans as well. I'm going to click compare now. From here, we're going to compare the plans side by side. And again, this is going to have the breakdown of a couple different things. One, it's going to have your premiums listed up top. We can see the different pharmacies listed over here. It's also going to show us estimated drug costs. So at CVS Pharmacy, we can see the Sanford Align plan has the lowest. Medicine Shop, it changes a little bit. Thrifty White changes quite a bit. That one is a specialty pharmacy, doesn't have a lot of in-network plans. So we'll leave with CVS. You can also see the estimated health costs. So this is that sheet we filled out with the hospital stay for 3 days, the 6 specialty visits, the lab visits, and it's giving us an estimated cost if for May through December, if we had all of those visits in the next 8 months, this is what it would cost on this plan. This is what it would cost on this plan. This is what it would cost on United Healthcare. The total estimated cost down here is your monthly premium for the rest of the year, because these plans are annual. They change January 1st through December 31st. $64 monthly premium for the rest of the year, May through December, plus your drug costs, plus your estimated health costs equals $1,588 annually. Same thing, now we're on NextBlue, and now we're on United Healthcare's plan. We can enroll at any time in any one of these plans by clicking the yellow button or the orange button. It'll go right into the enrollment. If we want to see more plan details, we can jump into the plan details of each plan and really see everything. The page before was just a high overview summary of benefits for each of the plans. Doesn't have everything listed there, but it has most things. From here, we can see all of the different benefits. And we can also, at the bottom, we can find things like the carrier's provider directory. We can find things like the pharmacy directory. We can also see things like the summary of benefits. So if I want to see like the actual carrier's booklet, we can download that. That'll be out there. Usually the enrollment form is out there for paper enrollment, the star ratings. Sometimes you'll find a formulary in here. Sometimes you'll find a explanation of benefits, which is the huge booklet that they're going to get when they enroll that has, 250 pages of the breakdown of the plan. I'm going to go back to the plan comparisons. From here, we can still see these plans side by side. We'll notice none of them have a deductible. The max out of pocket, so this is the most they would spend in care for a year on all approved services. You add up these copays that they'd have that we're going to explain here in a bit. They get to that max out of pocket, that's the most they'll spend in a year. So doctor visits, 0 on all 3 of the plans. Specialty visits, 25, 30, 0 to 35, just depending upon where that service is provided. Skilled nursing facility, these are pretty much going to all be close to the same, but the first 20 days are covered. Then after that, it's going to go to, with Sanford Alliance, $204 a day. With NextBlue, it's $150 a day. With United Healthcare, it's $203 per day. Home health care, 0 on all 3 plans. Outpatient mental health in network is $0 on the Sanford Align, $30 for NextBlue, $0 to $10 for United Healthcare. Emergency room, 75, 110, 125. Hospital stay, 150 per day for days 1 through 4, 400 per admission, 450 per day, days 1 through 5. So there's a little bit of a difference there between how the plans work, but you can see those comparisons side by side. Prescription drug plan coverage that's built into these plans. The deductible, is there one? All 3 of these plans have a deductible. This one is $150. This one's $240, $495. If your medication applies to the deductible, you pay full cost of the medication until that deductible has been met. Typically, it's tier 3, 4, and 5 medications. You pay full cost for until then the deductible's met. After the deductible's met, you get those tier 3 drugs for $42, $47, or $47. If it's a tier 1 or 2 medication, typically the deductible is waived. You can see this one has deductible waived, deductible waived. You get that for $0 for tier 1, $4 for tier 2. And this one actually has a tier 6, which is kind of maintenance medications, insulins, those are under select care drugs. That's a $0 copay as well. We go on a little farther, we get a link to those provider directories again if we want to go and search the actual carrier's provider directories. Very helpful tool because it's very important that you make sure all of your doctors and specialists are in the network. Down here, we can also see if all the medications are covered or not. We can see the pharmacies in-network pricing with preferred, standard, out-of-network. So we can see the different breakdowns into the different cost shares within the pharmacies. And then again, we have access to those plan documents to view those details of all the plans. We can also email this quote, text this quote to a customer, and they can self-enroll, or we can literally click enroll. If we narrowed it down, this is the plan they want. We can continue to apply. We can either, like I said, send it to them via text or email to submit, or we can complete the form for sitting face-to-face with them, continue to apply. And now it's literally just going through the few steps in the application to get that application submitted to the carrier. This first pre-enrollment statement is making sure that you go through all the different plan benefits, and that if it's an over-the-phone recording, or if it's an over-the-phone enrollment, that you are recording it and that type of stuff. This is where we're going to pretend this one's face-to-face. So this is an in-person enrollment. Just wanted to make sure that you went through all of the important features of the plan, highlighting all the benefits, and talking about maybe some of the pitfalls. So you're agreeing that you went through the benefits. This is all the disclosures. And then you apply. You can put in their information. If they have a mailing address, you can add that. You do need to add their physical address. That's for Medicare purposes to verify. We're going to go to the next page. Now it's going to have their Medicare number. And this is a demo account, so I'm not going to put in anything further, but you do need to change or pick an enrollment period. So for this one, it's new to Medicare. It's easy. A lot of the other times you're going to use, like I left employer coverage if they continue to work past age 65. There's a lot of other different special enrollments that you could choose from, but those probably are the two most popular. I'm new to Medicare, or I'm leaving employer COBRA coverage. Once you've selected that, you go on to the next page. The next page is going to be other information. It's really just going to be male, female, historical backgrounds, Hispanic, non-Hispanic, where you're native from. They're all optional information. The next page is your payment information. The payment information is going to be if you want to do Social Security deduction, if you want to set up auto pay from a bank account, or if you want to get directly billed. Once you get all that completed, you go through a review and a statement of understanding, hit submit, and it goes directly to the home office. The home office processes the application. The applications in the system are sent over with your NPN and or your writing number with that carrier. So as soon as they receive them, you as an agent are getting credit for it. They're usually processed within 48 hours because as soon as the application is received by the insurance company sends it to Medicare. Medicare approves the plan, sends it back to the insurance company. The insurance company then gets ready to mail out the cards and the verification letter for that member. So it's very straightforward, very simple platform. The beauty of it is you now have a customer profile with an enrollment completed, a copy of the enrollment. You can also go and update their drug list at any time. So I mean, we see agents that meet with 500 to 1,000 customers during AEP, and this is exactly what they do. They update their drug list, they rerun their plans, they make sure that the plan they're on is still good for them for the next year, and or see what the market looks like and find if they need to make a different plan selection for the next year. We can also shop. That was a Medicare Advantage comparison, and that same conversation, and this is a new to Medicare person, we're probably going to be looking at prescription drug plans, standalone drug plans, and Medicare supplement plans as well. So it does the exact same thing for prescription drug plans. We can see them by total estimated costs, and we can see that under this plan, all three meds are on the formulary. It's It's an estimated drug cost of $360 for the rest of the year, but the monthly premium is $117. And this is the lowest cost, or this is the lowest cost. So we sort of now total estimated cost, that's the cost of the medications and the monthly plan premiums. We click to view more details. It's going to give us the entire breakdown the rest of the year. We can see that the total cost for this person, for this drug plan, is $1,238 for the rest of the year. And that's basically because of this one Eliquis medication. If we want to see the breakdowns, we can click on all plan details. From here, we can go to the prescriptions tab. We can see what tier it falls into. So we can see that these two are tier 1. This one, there's no tier 2s. And then the preferred tier 3 is the Eliquis. We see that the retail cost is $639. We're getting it for initial coverage of $47. When we go see the estimated costs, we see the breakdown of every single month. You can do this for Medicare Advantage plans as well too, get that breakdown of cost. But we can see that the lisinopril, the atorvastatin, $13, $14.97, $47 copay for the Eliquis. This plan has no deductible. There's no deductible in any of the tiers, which is why it's $97 a month. But again, you can see those cost breakdowns for the plan. If we go previous screen, again, we can send quotes, email quotes, text quotes. A lot of times this is going to be paired with a Medicare supplement. So we're going to go to the Medicare supplements tab. We're going to put a May effective date, no spouse, automatic payment, May 2025. These questions down here, since supplemental is not guaranteed issue, it is when you turn 65, but after that 6-month window of when your Part B date is effective, underwriting could apply if you want to change your med sup to a different med sup. Since we're new to Medicare, turning 65 within the next 6 months or in the last 6 months, we're going to continue the plans, and it's going to give us a quote for a bunch of different plan options. I'm going to narrow it down pretty quickly by just picking maybe Plan G. Plan G is kind of the most comprehensive plan. Plan N have a copay plan option as well. We can do high deductible plans as well. But as you can see, we're sorting it by premium low to high. So we see in this instance, Medica right now is the lowest at $165, Aetna $170, Humana $171. If we want to look at maybe Plan N's, now you got Plan N's, Medica's $110. Or sorry, Mutual Omaha is $110, Medica $119, Humana. Again, if we want to enroll, we click the enroll button, or if we maybe want to add and compare 3 of them or a couple of them side by side, we could do that as well. So now we can see our plan comparisons and get those breakdowns for each of the carriers. You can see the premiums, where you would have costs underneath this plan. And then if you need to see the actual details of the plans, we can click on the details, get the complete breakdowns. So it's fairly robust. Click enroll, we can automatically enroll or send them enrollment links. But again, the biggest thing is keeping this data, housing it somewhere. A lot of agents in the past have used Medicare.gov as a tool, but that tool doesn't aid them in enrollments, and it doesn't allow them to save their customers' data. You can also compare dental and vision plans and hospital indemnity. So if you're selling a Medicare Advantage plans, you can pair that with a hospital indemnity plan to fill some of those gaps, whether it's emergency room, a surgical benefit, a cancer benefit, hospitalization benefits. That hospital indemnity can be paired with the Medicare Advantage plan to make a more robust coverage, or protect yourself against plans making negative changes in the future. So it's very, a lot of information I'm putting out on this little quick demo, but again, this is really just to get you to understand the power of the tool. And if you have any questions, concerns, always reach out to us here at Sunderland office. Our direct line is 866-680-2907. That'll get right to our team, and any one of us can help you get set up with your account and go through a little more in-depth demo if you need be. But thanks for taking the time today, and have a wonderful day.